So hi guys, let's talk about this case. So this is a 45-year-old male who presents with multiple spotty pigmentations on the face, and he was diagnosed with pigmented schwannoma. Also, he gives a very classical history that he has to he at the age of 25 he developed stroke, and at that time he was diagnosed as a case of cardiac myxoma, and he had developed emboli from it, and that is why he presented with stroke. So what is the diagnosis of this case, guys? So this is a classical case of Carney complex, which is an autosomal dominant disorder. Remember, this is a typical triad of PEM. Okay, P for pigmentation, which can be spotty pigmentation or ephylippids or lentigenes. Okay, E for endocrine overactivity, most of the time, which is primary pigmented adrenocortical disease, which is primary pigmented nodular adrenocortical disease. That's most common, and these patients usually present with Cushing's manifestation. And M for myxoma. So these patients usually have myxomas. They could be cardiac myxomas or some skin myxomas. And the typical gene which is involved with Carney complex is PRCAR1. Okay. Apart from that, there was a question that came in the INICET exam last time about what is Name syndrome or Lamb syndrome. So remember, these syndromes, guys, are very classical syndromes. Okay, so these syndromes must be well known. So I've highlighted this table for you. So Name and Lamb syndrome should be very well known because they are considered as a part of Carney complex. These patients usually have myxoid neurofibroma. They can present with blue nevi, ephylippids, lentigenes, and myxomas. So remember always, guys, so point of noted as Carney complex is different from Carney triad. So you're going to write in the comments below what is Carney triad and what is Carney Strata-Key syndrome. So that you're going to write in the text box below, right? And so this is a very classical Carney's complex, and the mutation is PRCAR1. It's autosomal dominant, and never forget PEM, pigmentations, ephylippids, and myxomas. Also pigmentation, endocrine activity, and myxomas. Always remember the endocrine activity is usually Cushing's, and apart from that, most common is, I told you, primary pigmented nodular adrenocortical disease. Also remember, pigmented schwannomas are also common in this complex, and that was this case which we started with. So this is a beautiful image which is also given in Wikipedia, which I'm just posting for your referral, and you can read this from Wikipedia also whenever you are free. Bye guys.